Councillor Ali, friends and colleagues, it's a great pleasure to attend with Lucy to take receipt of these bits of equipment. Now, the Merrill Charity has a distinguished history of donating huge pieces of equipment to our hospital. I recall I gathered last year there was a very impressive ultrasound machine donated to the cardiac department. Well, we're a much smaller specialty, therefore we have much smaller bits of kit. Madam, can I just, thank you very much. These don't look terribly impressive, but look behind these two pieces of equipment lie two enormously important statistics that Lucy referred to. First of all, in a recent survey of all the patients with Whipps Cross, 20% at any one time as inpatients had diabetes. That's not to say they came in with diabetes, but they had diabetes as a concomitant condition. 1 in 5 patients at Whipps Cross in inpatient beds has diabetes. That's a very high proportion. It's reflected across the country in areas of mixed ethnicity like ours. The other bit of statistic that's very important is that the prevalence of diabetes in the community, which Lucy also referred to, and although it's difficult to estimate that, from good epidemiological studies, it looks as though between 10 and 15% of the whole community of Waltham Forest has diabetes to a greater or lesser degree. And that makes it a huge priority for public health, for intervention by primary care and secondary care services. And its manifestations, as Lucy was saying, are very important, particularly the kidney complications, which are now filling up our renal unit of Whipps. We hope to get those numbers down over the next few years. We took receipt in 2002-03 of some more decorative equipment from our department. This was during the Merrill year of the late Councillor Liaquat, who dedicated his charity of that year also to the Diabetes Centre. And then if you come to the Diabetes Centre, you'll see brightly coloured chairs that I chose and frequently blamed for in the Diabetes Centre, together with IT equipment and carpets and a general spruce up of the department. So there is a long distinguished history of donation to both the hospital and also to the Diabetes Department. The charity for the Councillor Ali's charity raised about £25,000, and these are the 2 bits of kit. This is a syringe driver which is used not only for people with diabetes but widely throughout the hospital. And although it doesn't look like a kit, it is a state-of-the-art piece of equipment to deliver intravenous drugs. In our context, we use it frequently for patients with diabetes who need insulin intravenously because they're sick and can't take their ordinary insulin injections, or perhaps their tablets aren't being sufficiently powerful enough when they're ill and they need insulin. So these will be used widely throughout the hospital. And as I said, look pretty undistinguished, but it's 2,000 quid's worth of extremely safe and reliable equipment. This is looks even less impressive. I mean, you get something from Amazon about £5 in a box that's rather more impressive than this. But let me reassure you that this piece of equipment is truly state of the art. We were one of the first hospitals in the country to adopt continuous glucose monitoring. And this is the latest manifestation of that equipment. In fact, we have our first patient today. Laura removed the equipment from our first patient to have this test done, and it was terribly successful. I've got a couple of graphs over there just to show what kind of results these give. The idea is that instead of doing finger-prick glucose measurements 3 or 4 times a day, which are painful, and only give a snapshot of what's happening throughout the day, this measures your glucose levels continuously, 24 hours a day, and one sensor will last for about 5 or 6 days. So you get a brilliant idea of exactly what's happening at any time of the day, and particularly during the night, because the patients are not, of course, monitoring their blood glucose levels during the night. Very importantly, it's a wireless system, so the sensor which goes onto the arm transmits its data to this little bit of kit here, so the patients who are using this can read out their glucose levels at any time. It also gives printout of what's been happening to glucose levels over the past 1 to 6 or 12 hours. And very importantly, this little arrow here, which you probably won't be able to see from that distance, tells the diabetic person which direction their blood glucose is going in. So it's all very well to know that the blood sugar is 8.5, but you really do want to know whether it's heading up or heading down. This also has a very useful facility which is based on quite advanced technology which will predict if this arrow is going down when your blood glucose level is going to become dangerously low. So it predicts a hypo, possibly 20 or 40 minutes according to how you program the piece of equipment, and will alert the person that they are probably going to go hypo within 20 or 40 minutes and need to take action. This is going to be extraordinarily important for our young people and also for kids. Studies in the States have shown that kids as young as 5 or 6 take to these bits of equipment, as you expect, like a duck to water, and they can use these data to, first of all, learn about diabetes themselves, but also, critically importantly, to reassure their parents about what's happening to the blood glucose levels of their kids. Because it's a wireless system, this would sit in the bedroom, the parents' bedrooms, that they can watch the blood glucose measurement during the night. I can't stress how important this piece of equipment is. It's available in pretty well no other NHS hospitals at present, and we have 3 of these that we can use at any one time. Each of them costs about £1,000. The sensors, which are disposable and last for about 5 or 6 days, cost about 40 quid each, and through the generosity of the Mayor's charity, we've been able to get a good supply of the sensors, which are not available on prescription yet, and therefore we can make them available to all our patients. I do need to just thank a few people by name who've made all of this happen. I've just been sitting there in awe and amazement as people play on their computers and these wonderful graphs come up. That's what doctors do, of course, in little else, as you know. Laura Liu, who has already been referred to, is our senior diabetes nurse, and she liaised very closely with Imran Abbasi to make the arrangements between the mayoral office and the trust for getting all the equipment together. Of course, we're enormously grateful to donors and contributors, as Councillor Ali said. We're very grateful to our medical physics department, one of the unsung heroes of any major hospital's medical physics department that looks after the reliability and safety of the equipment. We're very grateful to the medical physics department at Whips Cross, who provided us with contact and gave us some leads on preferred and compatible equipment. These, of course, particularly the pumps for inpatient use, have to be compatible with what we're already using, and to ensure that the staff are already trained in the use of these pieces of equipment. From the building we're in this evening, we need to thank Lynn Rackley, the Member Services Manager, for her close liaison with us, and her team, especially Steve Michael, for organising tonight's event. I'm very, very grateful to all of you for your continuing support of what I think is one of the most important public health problems in the country at present. These pieces of equipment will make undoubtedly an immediate impact on the treatment of our inpatients and the management of our outpatients, and I'm very grateful to you all for coming along. If you need any further information, then Laura and I will be around to show you what these pumps do. We won't put anything into your veins unless you specifically request it, but we will make the appropriate sound effects to make it seem very impressive. Thank you very much.
Thank you very much, Doctor. And it shows, yeah, your money's gone in a safe hand, and it will certainly be for the betterment of the residents of this borough and all. So it's really thankful to all of you. And it falls on, I would love to ask our favourite mayor now, Madam Mayor, yeah, Councillor Anna Mabache to say a few words of Madam Mayor,